Uh, there is a magic of golden words is there in old teachers, whether it is Dr. Ambuja, whether it is people like Dr. Usha Sharma, that they have a power of empowering minds, shaping futures, and building Viksit Bharat. But you can't shape anybody unless there is a desire for the person to mold themselves. मुझे अच्छी तरह याद है कि जब बचपन में वॉर वगैरह का कोई सीन होता था तो ये होता था कि भाई हम लोग टीवी के सामने बैठ के सोचते थे कि मुझको जरूर कुछ काम करना है. उसी तरह से नाउ ऑनरेबल प्राइम मिनिस्टर हैज गिवन अ चैलेंज दैट इंडिया विल बी विकसित भारत बाय 2047. And once PM Modi has spoken about it, there is no doubt it will be Viksit Bharat by 2047. And now the experts have started telling it will be much earlier than 2047. Now, जब भी विकसित भारत होगा तो हर चीज जो है वो इम्पोर्टेंट होगी. Every person has to be contribute. खाली देखने से कुछ नहीं होगा, सेल्फी बनाने से कुछ नहीं होगा. We have to physically contribute in the development of Viksit Bharat. So I will share a few of my thoughts in this. I think the first three questions need to be clearly answered from you at the end of my talk. The questions will be there right in the beginning. The answers will be also there. You have to add on to it. But at the end of the class, you have to remember these questions very well. And also define what is going to be your role. So in the end, we are going to take a pledge. Now, the first question is, all of you must remember, where does Bharat Health stands after 78 years of independence? Bharat has made remarkable strides. When we got independence, our life expectancy was 32 years, and now it stands at 71 plus. You can find, as a gynecologist I'm speaking, you can find there's a rising institutional deliveries. I remember it in 2004, it was 25%, and now in 2025, it is more than 95%. There's a declining in infant mortality rate and maternal mortality rate. You want to know what is the infant mortality rate of the country? It is 28 per thousand. And the maternal mortality rate is 97 per lakh, which is now estimated to be 80 per lakh. It has not been made official, but unofficial report is that the maternal mortality is 80 per lakh. We have eradicated smallpox long time back. Trachoma is eradicated, polio is eradicated, and nearly we have eradicated maternal and neonatal tetanus. But their major challenges persist. We have rampant anemia and kuposhan all around us. PM Modi says that I feel ashamed, in a vast country like this, we have that kind of rampant anemia. हमारा narrative बदलना पड़ेगा as far as anemia and malnutrition is concerned, not that we can't do it. There is an epidemic of non-communicable diseases, accounting for 65% of the total deaths in the country. Care of elderly is negligible. But in 2047, the elderly, that is 60 plus, will be 20%, 1 in 5. So something has to be started as far as the elderly care is concerned. Utilization of elderly people is also important. Mental health is very bad. We have 1 in 1 psychiatrist for 1 lakh population. And health equity, you find that India is divided into 30-70. 30% who stay in शहरों में जो रहते हैं उनके पास हेल्थ केयर थोड़ी बहुत है, but जो 70% who live in villages, infrastructure is there, but till now it was not available. I'm going to talk about it how the country is shaping that particular aspect and deficiency. Now, what Bharat vision is there for health as far as 2047 is concerned? For a developed India, health is very, very crucial, because any country is said to be developed on many health indices, be it longevity, whether it's maternal mortality, infant mortality, cancer deaths, all those kind of things, the health of the country is judged. So in Viksit Bharat, we expect everybody should be healthy, productive, disease-free, with universal quality health coverage. Zero preventable maternal and child deaths, because every mother counts and every child has a right to breathe and live. Freedom from vaccine preventable diseases. Robust elderly care and robust mental health care should be also there, which is totally neglected. And a global leadership should also be India should be topping to give to rest of the countries an affordable healthcare innovation model. Now, what is the role do doctors have to play in Viksit Bharat? Doctor must become champion of preventive diseases. If you take care of prevention part, you can take it from me, 90% of diseases will disappear. You have to embrace digital health, continuously update your skills, fight for antimicrobial resistance, which is rampant. We are soon going to pre-antibiotic era, where no antibiotics are going to work, because there are a couple of ICUs in the countries where 70% cases the antibiotics is found to be resistant. Tackle lifestyle diseases. What is the number? We do not know, but 65% of the deaths are because of the non-communicable diseases. People of our country are health education hungry. Educate communities and work in underserved areas to bridge urban and rural gaps. Now, we need to answer what are the top 4 health policy priorities for Bharat now. Firstly, to strengthen primary health care. Secondly, is to control anemia, non-communicable diseases, mental health disorders. Ensure affordable quality health care for all, including marginalized groups, where it was non-existent for them. Avoid processed food and patronize home food. These are 4 priorities. Now, as you all know, in Ayushman Bharat, 40% of the population of a country is given Ayushman card, where every family will have secondary and tertiary care bills will be taken care of for these 40% of marginalized population. This will take care of the secondary and tertiary care. Now, as far as primary care is concerned, 1.7 Ayushman Arogya Mandirs have been operational, 1.7 lakhs. The main principle is preventive care, but beside preventive, they will give therapeutic, curative, palliative care, where anybody who is more than 30 years will be screened for hemoglobin, for their blood pressure, for their blood sugars. So you identify these non-communicable diseases early. Screening will be done for 3 cancers cancer cervix, breast cancer, and oral cancer. Everybody will have a digital questionnaire to know whether they have a mental health problems, and then they will be tackled. Because we cannot produce so many psychiatrists, I think training will be done to each and every nurse and a doctors who are a primary care people. School health program will be taken in a very big way.
Slides are not moving.
Slides are not moving. It is
slides are not moving.
No, I am not talking. Slides are not moving because I'm not.
Madam. Okay, madam. Okay, madam. Sorry for interrupting.
So I was just talking about this Ayushman Arogya Mandirs, where all these kind of training will be given, NCD screening will be done, mental health screening will be done. And because it is also the component is there of Ayush, so there will be yoga will be taught, Zumba will be taught there, and all preventive things will be focused, including Ayurveda tips will be given. So basic idea is the focus will be on preventive, but at the same time, it is going to be curative as well. Now, how can India eliminate anemia by 2047? You all know about it, that 50% pregnant ladies are anemic, 60% of adolescent girls are anemic, and the experts say that 60% total adolescents are there, where anemia incidence in adolescent girls is much, much more than 68%. So these people should have screening and aggressive treatment. They should be also given deworming tablets. If their hemoglobin is more than 12, then they can have a weekly iron and folic acid tablet. But if they are already anemic, it has to be treated by school health doctors on a daily basis, iron tablet. Behavior change has to be brought to them, that they say that their hemoglobin should be 12 gram%. And they should be also taught, if the hemoglobin is not all right, your academic performance is going to be very, very poor. So they also should go all out way to treat moderate and severe anemia. The principle will be the same as in pregnancy. All moderate anemia should be given IV iron, and the severe anemia should be admitted and given Paxil transfusion, and the rest of the treatment later. Deworming is very important. If you start giving just deworming tablets to your patients who are coming into the OPD, you'll find there'll be 30% drop will be there in hemoglobin, in anemia in your vicinity and the clientele which you see. Now, what Bharat is planning for adolescent health, they are future of our country, expand life skill education. What I mean by life skill education, there should be told many life skills where they should be able to negotiate, they should have a great awareness, because no adolescent girl or a boy wants a pregnancy around or to be caught in sexually transmitted infections. So they should be able to save themselves. They should be also taught menstrual hygiene management, anemia control, their mental health and stress counseling has to be done. HPV vaccination is a part of of a national immunization program. So this part will be definitely taken care by the government of India. And adolescent-friendly clinics. Narendra Modi is not going to do it. You and me have to do it. So the focus will be, as for the health is concerned, it should be on education and the school, the health education and the school education, academic education should go simultaneously. What I mean by, आप जब पहले से 10वीं की पढ़ाई कर रहे हैं तो आपको अपनी हेल्थ के बारे में भी नॉलेज देना बहुत जरूरी है. How will Bharat tackle rising non-communicable diseases? This is a very good initiative which is going to be started. Know your numbers. By this, everybody should know their weight, their height, their BMI, what is their blood group, what is their blood pressure, what is their blood sugar level. For elderly people, it should be HbA1c. ये सब आपको पता होना चाहिए. आपको अपने नंबर्स का पता होना जरूरी है. मेरा वेट क्या है, मेरे हाइट क्या है, मेरी कमर क्या है, मेरा ब्लड प्रेशर क्या है, और ये सब चीजें उसको पता होना चाहिए. और यहाँ उसको बताना भी जरूरी है. BP should not be more than by 120 by 80. Blood sugar anytime should not be more than 120, and hemoglobin should be, anybody who is 10 plus hemoglobin should be 12 gram %. Promote healthy lifestyle campaigns. At 30, screening, I told you, for diabetes, hypertension, and cancer will be done. You have to regulate junk food, tobacco, strengthen primary care management of non-communicable diseases. जब आपको पता चलेगा आपको डायबिटीज और हाइपरटेंशन है, तो simple treatment primary healthcare provider should be able to give very clearly. What about elderly health in 2047? Geriatric care services are extremely poor, non-existent. Home-based health models, problem of dementia prevention programs, senior-friendly insurance, which have just started for 70 plus people, and community support system are must. How will Bharat address mental health? When I say Bharat, it means Bharat ke nurses, doctors, you and me, homemakers, elderly people, students, volunteers. I'm talking about it is responsibility of everybody. By training primary health care providers in basic mental health, scaling telecounseling. आजकल mental health वाले लोगों को stigma की तरह से देखते हैं. So you have to do destigmatization campaign around mental health and insurance coverage for psychiatric illness. What digital solutions are shaping the road ahead? Ayushman Bharat, a digital mission. Everybody will be given Abha card. Today I got a senior citizen Ayushman card, and there in that particular card, my Abha number is also given. It means it will give lekha jokha of all my health. मेरा ये क्या पैरामीटर्स होने चाहिए उसको मुझको भरना पड़ेगा, and hereafter if any time I get admitted, this particular Abha card they can get my information about me in any part of the country. E-pharmacies will be there in plentiful, so you get subsidized medicines. AI diagnostics have a very future that you get blood tests done and they will be able to tell you about future diseases, including cancers as far as you are concerned. And I think, because already you've heard about AI hospitals, these are coming very fast, and each one of you have to update yourself, otherwise you'll be out of the cycle. Remote monitorings, telemedicine can do your care by remote monitoring. Health data registries are all crucial for equitable access. How will India prevent antimicrobial resistance? I think all of you have to see to it that we have to have a rational antibiotic use, not to prescribe antibiotics where it is really not needed. And you have to become AMR ambassadors in hospitals. You have to create public awareness, and we have to work together for banning OTC sales without prescriptions. How to make pregnancy safer by 2047? I think all of you are gynecologists yourself. Universal antenatal care, I just wish to tell you here that 95% deliveries are taking place as institutions are concerned. But as for the North is concerned, the antenatal care, in contrast to Kerala, Kerala is 95% plus, while it is 60% in the North India, and that also antenatal care is very, very lousy. There is, you have to do a high-risk pregnancy tracking, which any community health worker like ASHA, midwife, and nurse can do it. GDM screening has to be done for DIPSI. Justosis core screening has to be done initially and at repeated visits. And 100% skilled birth attendants should be there at delivery. So not only you have institutional deliveries, 100% skilled midwife, nurse, or a doctor should be delivering you. In emergency, and they all should be trained in emergency obstetric care care. And these are called emergency obstetric care center. The delivery will take place. And maternal audits to prevent avoidable deaths and near-miss deaths. What must gynecologists do differently for Viksit Bharat? Focus on preventive health. Cervical cancer screening and HPV. Here my request with folded hand is HPV vaccination into 9 to 14 girls the government will give. What about the screening? The screening is very bad, which gynecologists have to only do it. VIE and VILI, you have to learn it and offer to 100% of your patients. HPV vaccination beyond 14 years, you have to give to people up to 45 years. Anemia eradication, your focus should be 200%. Safe motherhood practices should be your priority. No mother should die and every baby should survive. Menopausal care also require great attention. I can see that many gynecologists are training themselves to be menopausal experts. And what you have to do in big way is community awareness by digital platforms. And I think, you have to see to it that your neighborhood, 2 kilometers across your neighborhood, you should be the champion for community awareness. How will Bharat prevent stillbirth and neonatal deaths? Here I just wish to tell you that if universal GDM screening, gestosis score, high-risk screening is done, and a good fetal monitoring is done, you find these are the major conditions which give rise to problems of small baby, growth retarded baby, and sudden stillbirths can happen in such cases. One has to see to it that you should offer them a good fetal monitoring. Early detection of red flag sign you should be obsessed with. And it is said not only Kerala, in Hyderabad also, there is a hospital which has got 10,000 deliveries per year, just because adopting obsession with red flags, they have brought the mortality to 0. So whenever the red flags appear, this ASHA worker, nurse, junior doctors, even senior doctors should be able to tell this mother that whenever the red flag sign appear, it is a sign of danger. If you do not act fast and do not reach the hospital, death is ensured. So this must, through this mother, the family should also recognize that red flag signs are not good for the survival of the pregnant mothers. And it is said that if the mother is saved, the 50% of stillbirths also can be saved. Timely referral with red flags is very important. Quality intrapartum care is important. 50% of stillbirths are intrapartum stillbirths. So जो patient अपना fetal heart लेके आती है, उसको आपको ensure करना होता है at the end of the delivery, you should give a crying baby to that mother. And learn neonatal resuscitation and care. Anybody who delivers, whether nurse or a doctor, have to take responsibility of neonatal care and resuscitation. And Delhi, we have started this particular thing, but I will just tell you, in Kerala, it is 100%. All nurses have to take a training and certificate, then only you can be posted in the labor room or first referral centers. So I think the similar kind of things have to be done by gynecologists. What should be the medical students be trained for? They should have practical community health obsession, digital health literacy. They should be great. They should be, with their messages, they should be able to inform thousands and thousands of people on key positive messages. They should be mastered in good communication in their language. They should practice ethical medicine, evidence-based practice, and a holistic patient-centered care. How will Bharat tackle high out-of-pocket health expenditure? 60% of the medical expenditure is done by people from their own pocket money, which is pushing 5% people of a country below the poverty line. So we have to expand Ayushman Bharat coverage to include OPD as well as diagnostic care, and public-private partnership models of healthcare has to come, where they give the space and you have to make the hospitals, or government-made hospitals you have to run. regulate private hospitals, and strengthen public sector facilities. What is the role of technology for rural Bharat? Mobile health vans, telemedicine kiosks, that you make this, and you can be connected with experts for telemedicine consultation. Portable diagnostic. The time is not far away that you find this community health worker will be roaming around with blood pressure apparatus, with the pulse oximeter to your places, and everybody will be able to know whether your things are all right or not. I think these two things are very basics. You come to know about the pulse, you have come to know about the oxygen saturation, you come to know about the temperature as well, blood pressure, and what else you require for a person to know that you're okay as far as your health is concerned. Drone delivery for medicines and vaccines, community health workers using health apps should be a reality very soon. How will Bharat ensure health for all? Know your numbers. I just now told you everybody should know their blood group, their hemoglobin, height, weight, kamar kitni hai, BP kitna, blood sugar kitna, all that kind of thing that you should know. Robust primary health infrastructure. I just now told you 1.7 lakhs. This Arogya mandirs have been created, and I think functioning has to be absolutely 100% class. Then I'm sure preventive medicine will be a Kabul bala hoga. Mandatory health checkups. You find in Kerala there's 100% health checkups is done, which is hardly inculcated as for the north is concerned. Trained human resources. I think student volunteers, who are student health ambassadors, have to be created. Community health standard ambassadors to be created. Senior citizens can opt for to become ambassadors, and homemakers also can be trained. Homemakers did a great job during COVID times, and they can be trained as much as ASHA workers can be trained. I think they can be even better than the ASHA workers. And equitable resource allocation should be there among the poor and the middle class and everybody alike. And accountability should be chipped in at every level. You find, 5 times you falter, your degree should be taken, whether you're a nurse or you're a doctor, as is done in UK and things like that. What about immunization goals for 2047? Vaccines are the biggest lifesavers. 100% immunization to children, to 100% immunization to adolescent people, adult immunization, senior citizen immunization, including HPV, rotavirus, and COVID boosters, as the government guidelines come from time to time. New vaccine for emerging threats should be taken. And my request to each one of you who's listening, flu vaccine taken yearly can save you with a lot of problems. And maintaining cold chain integrity has to be there, which India has already developed the power, and I think it has to be further strengthened. How will Bharat handle the burden of cancers? Early detection drives, screening camps, tobacco control, vaccination, affordable treatment, palliative care, and a patient support system has to be created. What must people of Bharat do for their own health? Adopt healthy diets and exercise for each one of us. Annual health checkup is must. People are 50 plus, this checkup is twice a year. Mental wellness is very, very important. Participate in screening. Never get scared about it. Kuch nikal jayega to kya hoga. Avoid self-medication, especially with antibiotics. Stay informed. What policy changes are needed for health workforce? Better pay and working conditions for nurses and doctors, more seats in medical and nursing colleges, rural service incentives should be given, continuous training. I think every nurse and a doctor has to have a continuous training to upgrade themselves. Respect and the safety for healthcare workers. How can Bharat fight medical brain drain? Provide growth opportunities, decent working environments at home, research funding, better infrastructure, and a global collaboration. What will Bharat address urban health challenges? Tackle air pollution, address anemia, lifestyle diseases, urban slums health access has to be seen, and we must go outside one day in the month to these community and take care of their health. Elderly isolation, I think this A lot of work need to be done for elderly people. Mental and stress-related disorders, again, should be taken on a war footing. Each one of us should have a certificate course to how to handle these stress-related disorders. What partnership can help Bharat achieve its goal? Public-private partnerships, global collaborations, civil society engagement has to be done. More and more community has to be involved, community volunteers have to be made, and active citizen participation has to be made. How will Bharat manage health emergencies and pandemics? Strengthen disease surveillance, hypertension, diabetes, rapid response team. आपको हार्ट अटैक हो गया तो हर एक को जानना आना चाहिए कि ये हार्ट अटैक पड़ा और इसका हार्ट बचाना है तो हमें क्या करना पड़ेगा. उसी तरह स्ट्रोक के लिए पता होना चाहिए, उसी तरह एनाफाइलेक्सिस के पता होना चाहिए. हर इमरजेंसी का ट्रीटमेंट आपको आना चाहिए एज ए बेसिक MBBS डॉक्टर. वैक्सीन एंड ड्रग मैन्युफैक्चरिंग कैपेसिटीज we have to increase further. We are already the source of 60% vaccines and generic drugs for the world. Crisis communication system also we have to do it, as we have done it in COVID times, that every television channel gave so much of information to armed public that every small child also became the doctor those days. What role does health literacy plays? Health literacy is very, very important. I told you the public is health information hungry. Informed citizens take preventive measures. They demand quality care. They comply with treatment, and it reduces quackery automatically. All are key to public health success. How will Bharat use Ayurveda and traditional medicines? Evidence-based integration with modern care. I told you about Ayushman Arogya Mandir. Quality control has to be seen. Surveillance of these mandirs Arogya Mandir has to be very vigilant. Research on efficacy and safety should be there. And we seniors should share what works with which does not work. And a global promotion as a soft power should be there. We should come out, as far as the health is concerned, biggest soft power to give it to the world. How do we measure progress? By monitoring indicators like MMR, maternal mortality rate, infant mortality rate, anemia prevalence in our pregnant ladies, in our adolescent girls, NCD incidence in young adults and elderly people. What is the insurance coverage? Doctor-patient ratio. The doctor-patient ratio in our country is okay. As far as the nurse ratio is concerned, it is 2 per 1,000. It should be 3 per 1,000. As far as the doctor-patient ratio is concerned, it is 1 in 825. We are better than that. And patient satisfaction should be plus, plus, plus. What is the message for every doctor, policymaker, and citizen? Health is not a privilege, it is a right. Health is not a privilege, it is a right. A healthy Bharat is everyone's responsibility. Let's work together to gift Viksit Bharat to each one of us, a disease-free, productive future for every citizen of ours by 2047. Thank you very much.